My name is Margarida Freitas, and I'm a physical and rehabilitation medicine physician from Portugal. And today it is a real pleasure to be here with Dr. Mark Bayley. Dr. Bayley is the Program Medical Director and Physiatrist in Chief at UHN Toronto Rehabilitation Institute, and is also a professor at the University of Toronto. We are here today to talk about the ISPRM 2026 Congress, which will take place in Vancouver. And Dr. Bayley will be joining us as a keynote speaker. And I would like to thank you, Dr. Bayley, for your time, and it's a pleasure to be here with you today.
You're welcome. Thanks for having me.
I will start with the first question. The first question is, could you share some spoilers about the content of your session as a keynote speaker?
Sure. I would love the audience to ask the question to themselves, did they know that there are hundreds of randomized controlled trials on motor recovery and exercise following stroke, which raises some important questions. What's the ideal timing of those interventions and exercise? What's the ideal dose and frequency of those interventions or treatments? And then, of course, worldwide, with limited time and funding, how do clinicians actually decide which ones of these many different exercises should they do first, and which ones should they do if they have more time? A second thorny issue, which I'm going to talk about and raise, will be this issue that we know there's a window of time during which motor recovery after a brain injury or stroke occurs. And it seems to be that motor recovery starts to decrease in the period around 12 weeks after a stroke. So what we're going to talk about is a little bit about the research that is examining the ability to use additional strategies and biological strategies to enhance neuroplasticity and try and extend that window and take the most benefit from that time when your brain is particularly primed. And I'm happy to share some of the work that's going on in the CAN Stroke Trials platform. And finally, with all this evidence and research going on, how do we get clinicians and ensure that they actually follow the evidence? And we will be discussing the challenges of bridging the gap between what we know and what we actually do in practice, and some of the strategies we've been studying to enhance uptake of the best practice evidence.
Thank you. That's amazing. And that's really the foundation of clinical research in physiatry. And you have described perfectly the challenges that we find when we are trying to find evidence in our rehabilitation protocols. That sounds amazing. And now to the second question. What would you like to highlight about the ISPRM 2026 Congress in Vancouver, both in terms of the city itself and the scientific program?
Well, I'm very excited to see all of my colleagues in physical and rehabilitation medicine join us in Vancouver. As a proud Canadian, I will have to tell you that Vancouver is probably our most beautiful city, set in the mountains, and there's so many exciting things you can do while you're with us, including taking a walk along the seawall in Stanley Park. If you really are looking for some exercise, you can climb up Grouse Mountain for a beautiful view. And then there's many great restaurants and many other activities you can do in the area, including climbing into the mountains at Whistler or going across to Vancouver Island to visit Victoria. So we really are very excited for the world to join us in Vancouver and looking forward to a great conference with lots of other great colleagues.
That sounds perfect. You have convinced me. And I would like to thank you, Dr. Bayley, for sharing your insights and giving us this exciting preview of what we can expect from the ISPRM Conference 2026. And I would like to invite you all to join us at the ISPRM Congress in Vancouver next May, and it will be a unique opportunity to experience an outstanding scientific program in a truly remarkable city and to connect with the global physiatry community. So thank you, Dr. Bayley, once again, and I hope to see you all there in Vancouver. Thank you.
Thank you.